Hello, my name is Mikalina Dobrovskaya, and I'm a Coordinator Client Services at the Population Health Research Network. Today I'll be presenting on designing and planning a linkage study. So in this presentation, we will delve into how to design and plan a linkage study. If you would like a recap of what is data linkage, or if you'd like to learn more about accessing linked data for cross-jurisdictional research, then take a look at the presentations in this series linked in the slide and also available on the PHRN YouTube channel. So before we go any further, I just want to explain what we mean by administrative data, as this term gets thrown about quite a bit. When we talk about administrative data, we mean information that is collected every time an individual accesses or uses a service out in the real world. So some examples include going to the hospital, completing high school, or receiving a prescription for a medication from your doctor. As you can see, linking the information from different services that a person uses potentially across their entire lifetime could be very valuable, both from a research and non-research perspective. So every research project starts with a question or a hypothesis. The research question will usually inform how you will be able to answer it. And in some cases, it may be appropriate to use linked administrative data. And in fact, there can be many advantages to using this type of data. However, linked administrative data may not be a suitable way for you to answer a particular research question. Remember, administrative data is secondary data, which means it is not collected for research purposes, but for other purposes. Some potential limitations of administrative data include the dataset date range limits. So, for example, data collections may only be recently established or only go back up to a certain point. And if you're interested in studying, for example, long-term outcomes from patients who were diagnosed in the 1970s for a particular condition, it may not be feasible to obtain that information because it just wasn't collected at the time. Geographic or clinical granularity limitations might exist. So if you need to drill down to an exact location or to obtain details at the level of a treating clinician or a single patient, linked administrative data is not always the best option. There may be restrictions in place as to how granular the data can be, or it just may not be collected at that level to start with. Also, some populations of interest may not be included in a data collection or available for research purposes. So, for example, records of patients attending an outpatient clinic in a hospital setting may not be captured in hospital admissions data. And finally, there are changes in policy and coding practices over time. Secondary data collections operate under various legislation and policies, and sometimes how or what is collected changes over that time. So you need to think about how this may impact any findings. For example, and this is a real life example, if a sudden, seemingly unexplained drop in ED attendance occurs for a given condition, this could be a reflection of the change in policy or coding practices than a true change in the number of emergency department presentations for a particular condition. So these are just some of the things to keep in mind. Now, the objectives of this presentation are to help you to design a research project using linked data and to outline the design process and how it can be applied to successfully plan a data linkage study. One of the objectives is also to highlight the key themes that you need to consider as part of the linkage study design. And then by the end of this session, you should be able to understand what's important when planning a linked data project and what's needed to design a successful project. You should also be able to identify the people and resources available to you to gather information and feedback on your study design. So, a little bit about the study design process. Of course, good planning is crucial for any project to be completed successfully and on time. This diagram shows the basic concept of knowledge gathering, defining a project, then diving deeper into the areas that may not be very well understood or need further thought, and then refining the project based on the previously gathered information. For data linkage projects, this process is iterative and quite intensive, especially at the beginning. And when there's a considerable amount of information to digest and fashion into a coherent data set. It is important to note that you're not expected to come up with the entire data linkage project methodology on your own straight from the beginning. The client services staff are key contributors and they help the researcher create a project that's both technically feasible and meets the various legislative requirements of the participating jurisdiction or jurisdictions. So speaking of some of the data sources, how do we find what data is available? A good starting point is the PHRN website, which is just shown in the bottom left hand of the screen. It contains information about and links to the more frequently requested datasets available from each jurisdiction. This is not an exhaustive list, so if there is something in particular that you're interested in or have heard about, you can always contact the individual jurisdictions, data linkage units, to see whether or not they have something available if it's not listed on the website. And you can also visit the individual websites of the data linkage units, which will be listed at the end of the presentation. So I have mentioned the people who can help with the design and planning process. There are a lot of people who can help you with this. The PHRN Coordinator Client Services Officers, one of which is myself, and the Data Linkage Unit Client Services Officers around the country are always available to answer any questions if you can't find the information you're looking for online or if you need a little bit more detail about anything. It's always a good idea to talk to the client services officers of the data linkage units so you can familiarize yourself with the application process and any jurisdiction specific requirements before you apply as well. So we're going to talk a little bit about data discovery, and as previously mentioned, there are some limitations to administrative data. Data quality can vary. There are data quality statements that might be available from individual linkage units. This could either be on the data linkage unit website or they could be requested directly from the data linkage unit via email. Most administrative data, it's important to note, is not available in real time for research purposes. There's often a lag between the data collection, linkage, and data availability for analysis. In some cases, the lag can be up to 24 months, and sometimes a lot less than that, depending on the data collection in question. It's just important to take this into consideration in your study design. And if requesting data from multiple jurisdictions, check whether the same variables and level of information is available in all jurisdictions. For example, will full date of hospital admission be available from all jurisdictions? This is an example table of the types of information that are available as part of a linked data project. So obviously a linked data project can include many different types of data as part of the study design. And it's important to have as much information under your belt as possible when deciding on which data sets you would like to request. As part of your research, spend some time looking through the PHRN and individual data linkage unit websites so you can get an idea of what data may be available. Familiarize yourself with some of the dataset limitations. Information on commonly accessed datasets, such as hospital admissions data, is usually available from the Data Linkage Unit website. And you can find out about date ranges available and what variables or data items are available for research purposes from the website as well, either from the PHRN website or from the individual Data Linkage Unit websites. Some design questions to consider before you apply for linked data are: what data do you need? The table in the previous slide gives you an idea of the many data sources that may be available to answer your research question. Remember, the more data sets you'd like to include in your study, the more approvals you will need to seek, as generally every data collection has its own data custodian who decides on whether the data you've requested from them can adequately address key questions in your proposed research project. Another question is, how will the data be linked? So you need to consider the high-level linkage methodology, and you may wish to link external data or a cohort of participants that you've recruited to other administrative data, or you may want to access information that is already routinely linked by a data linkage unit or units. Again, this is not something you need to develop in a vacuum. Client services officers are there to assist you with the methodology. How will the data be analysed? This is quite important as you'll need to provide a detailed analysis plan as part of your application. Having access to an experienced linked data analyst could be very helpful, or if that's not feasible, you could attend a training course, for example, Introductory Analysis of Linked Health Data at University of Sydney or University of Western Australia. It will also be important to determine if your study group of interest is large enough to give your study adequate statistical power to proceed in the first place. So, for example, if you're interested in studying a rare disease identified through hospital admissions data, you will need to consider whether the cohort is of adequate size before embarking on your project. And finally, how will the data be managed? Again, very important. That is, how will it be securely transferred and stored? Who will have access rights to the information? Details about the data retention and correct disposal of the data once the project is complete. All of that will need to be considered. So we'll go into a little bit more detail about the specific processes just discussed in the earlier slide. With regards to linkage, you're not expected to know the details of the linkage methodology, as I mentioned, when you first start, but it does help to understand how linkage works. You will be guided through the process of developing the linkage methodology for your project by the linkage units, but you are also expected to demonstrate an understanding of the process as you're going through it. If you're recruiting participants for your study and you want to link to their administrative records, you will need to be able to explain concepts such as data separation and role separation as they apply to your project in your application for linked data. Just briefly, role separation means that if you are recruiting participants and would like to obtain their linked administrative data, you need to ensure that you have different people in your team who handle participant identifiers, such as names and addresses, versus the de-identified linked data provided to you for analysis, sometimes also called the service data or the content data. This is to minimize the risk of potential re-identification of individuals in your study. So similarly, data separation means that you keep participant identifiers separate to the linked content data or the service data that you will analyze. And again, this is to prevent re-identification of participants or minimize the risk of re-identification. Participants assigned a unique study ID at the time of recruitment are usually then identified by their ID throughout the project and data analysis without the need to use names or other sensitive information. Something else to consider, apart from the linkage methodology, is your study group definition and your data extraction parameters. You will need to define your study group or groups and separately outline your data extraction parameters. And it's important to note that these are different things and often get conflated. There are lots of different study designs, the most popular being cohort and case control, and there are a range of ways a cohort can be defined for your study. A cohort may be selected from one or more data sets, or may be provided by the research team if participants were recruited into a study with a data linkage follow-up component. The key is to be specific, stating where the study group should come from, any date ranges, and detail about the nature of the condition, procedure, or service accessed. For example, all individuals with a first ever diagnosis of aortic stenosis as recorded in the hospital admissions data collection between the 1st of January 2020 and 31st of December 2021. So you can see it's very specific. Once the study group or groups are clearly defined, you still need to consider which records you wish to access for these individuals. If you're asking for hospital admissions records for your cohort of individuals with aortic stenosis, going back to that study group example, you need to specify whether you want all their linked records or only those specific to their condition, or perhaps only those records that reflect the conditions you're interested in studying, such as certain comorbidities. Similarly, you'll have to explain whether you want all their linked records going back to birth or only for the past 10 years, or perhaps not at all. It's important to provide a rationale for why you require the data you're requesting, and it needs to be clearly tied back to your research objectives. We briefly touched on data management previously, and I won't say too much except that data management guidelines and resources will be available from the data linkage units. And you will need to cover certain aspects such as the physical and technological security of the place or places where the data will be stored or accessed from. You'll need to talk about how the data will be used, any data retention and disposal details as well. You do need to become familiar with the data management guidelines, and there will be a detailed data management plan that needs to be completed as part of your application for linked data. Just a quick note around consent. Access to linked data can be with consent, but under certain circumstances, a project can request a waiver of consent. Just flagging that you will need to think about this in more detail. However, the topic is beyond the scope of this presentation. We recommend that you check out the link to the NHMRC guidelines and resources to ethics and consent. And finally, just some links to some of the materials that have been mentioned as part of the presentation and the data linkage units mentioned previously. And of course, for more information, please email phrn-oas@uwa.edu.au or visit our website.